I want to first begin by recognizing the absolute remarkable work that's occurring by all healthcare workers today, all of our colleagues who are working on the front lines during really extraordinary circumstances and doing a truly amazing job of responding right here in Connecticut to this crisis in this command center, which thousands of people have already taken advantage of, and our team who's supporting them have done an exceptional job. We've developed a website that's public-facing, that has been very active, and is leading people to the right place and providing essential information, real-time, 24 hours a day, 7 days a week. And we have put forth, through our partnership with our GoHealth network of 22 urgent care centers, we have started using telehealth capabilities for virtual visits that allow people to receive care and attention from the comforts of their own home. It's my pleasure to introduce our Chief Clinical Services Officer, Dr. Ajay Kumar, who will further elaborate on the efforts that we're putting in place.
Thank you, Jeff. I just want to go back. We started preparing for this in early January, and I think our hard work and our preparation has really paid off. So far in Hartford HealthCare, thank God, we have not seen a single case. We've not had any positive cases. We've tested many, and all those individuals who came who were person of interest or we were concerned about, they were managed and triaged very appropriately in the right level of setting. And that is what is required for the preparations to happen. That's how we stay ahead. We've not seen, and we don't intend to have any cancellation of our services in any area, whether it's the surgical centers or any area. We are very well prepared. Where individuals who actually may have some symptoms, have a travel history, they can drive up to a location and get tested done. They don't even have to step out of the car and get the testing done. And tests can be sent and inform them later on what the test result was. We're still in the pilot phase. We're still early in the stages of making sure that all the infrastructure testing capabilities are in place.
Our environment really does set up the possibility, because we've seen it through this center, that there are certain visits that can be served through a virtual visit here, because a lot of them are generating questions that we can answer, whether it's travel screening, whether it's symptoms, and we can serve those patients here and provide a good patient experience. It also aligns very much with what Ajay talked about testing, because we'll have the ability to, through that encounter, order that test and make sure the patient gets to the right testing center. So that's really the concept. But what we're also doing is providing the ability to mitigate exposures of patients to offices where they shouldn't be and don't need to be.
And we've got calls coming from a lot of physicians from different healthcare systems at the moment asking our advice. Earlier on, I was informed a lot of infection prevention, infectious disease doctors of other healthcare systems are seeking our help as well, and obviously reducing some of the burden to be able to manage the anxiety we have in the community.
Look, just describe what they can expect to see.
They can expect to see drive up and greeted by one of our colleagues warmly and reassuring way. And then they will see somebody holding a swab, which swab will be taken from the nose and the mouth and will be sent away, and they'll go after that. They need to register some registration of what needs to be done.
And some paperwork, I imagine, or is it all?
We would like to do all through our call center electronically, and that would be done prior to their reach there. We want to make it as convenient as possible.
As far as the information that's being pushed out to multiple devices, are we getting information from the state level or worldwide at this point when it comes to COVID-19?
I'm glad you asked this question. So one of the challenges we have is a lot of misinformation to a certain extent, which has been happening. So our team has been watching the trend across the world, across the country, in Connecticut, and how we are responding. And we're putting out the latest information on our website. So the text message allows you, the community members, to be educated. I think that's very important in these times. Number one, get the information from the source which we think our experts have validated and looked into appropriately. And I want to remind everybody, this is the clinicians are sitting here who are advising. We have infectious disease doctors, we have internal medicine doctor, we have nurses who are helping the community members.